And to speak more about this, Dr. Mercy Korir now joins us here in studio. Many thanks for joining us, Dr. Mercy Korir.
Good morning, Michelle.
So let's begin with why, in the first place, the doctors rejected the deal by President Uhuru Kenyatta.
I think the major reasons why the doctors did not take up this deal was because, one, it is not what it is in their CBA that was signed in 2013. Remember that the doctors, since the 5th of December, have been very categorical that theirs is, they're seeking for the implementation of the collective bargaining agreement. And this collective bargaining agreement, apart from having remuneration benefits directly to the doctor, it also speaks towards improvement of public health care sector, from facilities, and also just how to manage the human resource in terms of doctors, where they don't have to work overtime. There's a proper training schedule or career progression, because much as we have general practitioners, also we need the specialists. So the CBA addresses all this, including staffing levels in different facilities across the country.
Right.
And also one of them was employing about 1,200 doctors annually, so that we can meet the gap that is there between our doctor to patient ratio. So to the doctors, yes, the government has given a monetary compensation or remuneration from the strike. But what happens to the other bits of the CBA? Because remember, this strike has not only cost time to the doctors, but also there are patients and there are people whose relatives have not had the privilege of going to a hospital and seeking the care that they would need,
right,
or they have gone to a private facility and they've had to incur extra costs that they would not have otherwise incurred. So for the doctors, it will be unfair to consider a remuneration aspect of the CBA, yet the CBA is
holistic. So the decision,
yes.
I mean, the agreement or the deal that was given by the president did not involve the other aspects of the CBA, just the remuneration bit of it.
Yes, yes. If you remember the statement that was put out by the spokesperson, Manuel Sipisu, it only had the remuneration where they bumped entry level from job group L to job group M. So, and then it just addressed different allowances to the doctors on the other sections of the pay grids. But it did not touch on the other aspects of the CBA.
Right.
And that's why the doctors have been very categorical that they want an implementation of the CBA, because this strike was not just for the doctors, but also to the people that they serve each and every day.
Right.
Yes.
Right. Okay, and then of course, after the rejection of that deal, now the government has come up with a different proposal to hire doctors from abroad to help alleviate the situation. That's the word, alleviate the situation. But are these doctors coming to replace the existing doctors, to complement the existing doctors? And is this move welcome among the Kenyan doctors?
Considering that part of the CBA request for hiring of 1,200 doctors annually, it's a move that is welcomed by the doctors. But if the government is actually very serious about it, then they should know that for a foreign doctor to be licensed to practice in Kenya, it does not take a day. It's not like you will just even organize within a week and they come and they work. They have to be vetted by the board. Their qualifications, their licensure from their country of origin has to be vetted by the board, and it has to be satisfactory that they can actually practice and offer services in Kenya. And the other bit, remember there's a time when the government was saying they'll get doctors from Cuba, from China. They have to prove proficiency in English, because you don't expect a Chinese or a Spanish-speaking doctor to go to the village and they cannot communicate. So it's a whole process.
In fact, sometimes Swahili is also even more important.
Yes, and remember there are some areas where people do not quite understand Swahili, and you sometimes as a doctor you're forced to learn a few things in the local dialect or in the local language for you to be able to communicate. So it's not just something that they will just bring in one day and they'll have sorted the strike or alleviate the problem. It's a process. And so they really need to think about it. But I think as a Kenyan, it's a welcome move, because the more doctors we have, the more services we have to offer.
Right.
But will it have solved the problem that the current doctors are on strike for? Remember, they're not just on strike for monetary gain. They're also on strike because they want an improvement of health facilities.
Right.
So you can imagine if somebody is coming from a foreign country where they're used to having all the facilities and equipment that they need to offer services, then they come to our sector and they have to improvise on almost each and everything.
Right.
To be very difficult to work,
Right.
and they may not be really sustainable. So I think the government should actually sit with the doctors and try and get, as Professor Ogola said, get an implementation matrix of the CBA, because the doctors are alive to the fact that there are some aspects that will be achieved now, there are some that will be phased out.
Progressively.
Yes, so the government just needs to sit down and agree on an implementation matrix.
Right.
And it's unfortunate that they're saying they will consultations with stakeholders take another 30 to 60 days. Remember, this strike is on its 34th day.
Right.
How many, what cost has it been to the people seeking healthcare? What cost has it been to doctors that are in training? Remember that Moi University suspended training, the undergraduate training,
Right.
or the clinical years, because they don't have any consultants and the hospital cannot support this. So the cost of the strike is not just immediate on just patient suffering, but we are seeing it transcending to across board in everything that touches on the medical sector. So give it another 30 to 60 days means we're just going to compound and make the problem bigger than it is.
Right.
So I think the two parties, the doctors, they say they are willing to negotiate. The government is saying they are willing to negotiate, but we are not seeing the
nobody's
fruits of the
actually
negotiation.
negotiating, right,
Yes.
right.
So I think they need to take it as a matter of urgency. And we've seen maybe Parliament should intervene. We've seen the Parliament could convene a special sitting to address a certain issue. Maybe it's time for them to convene a special sitting and address the doctors' strike so that it can be solved once and for all. And the government and the doctors do not even need to reinvent the wheel. The 2011 strike, or the doctors, which was the first major strike post the 2010 Constitution, gave rise to what we have as the CBA now. And during that strike, there was a Musimi task force report that really outlined how to solve the issues that are plaguing the healthcare system, not just the human resource, but in terms of infrastructure, training, equipment, medical supplies. It outlined all that, and with each component, there was a budgetary allocation to it on what it would take and how long the government would take, so that if implemented, then we would not have had this strike. So for me, if both parties, the doctors and the government, had actually sat and implemented or followed what the Musimi Task Force report put in place, then we would not have a strike. So I think it's paramount for the doctors and the government to sit and solve this issue once and for all. We don't want to hear that in another year, 2 years.
Doctors are still on strike.
Yes.
And I mean, we were talking about the feasibility of hiring doctors from abroad to help ease the situation, but you say that will take a considerable amount of time before they integrate themselves into the Kenyan health system. Of course, learn Swahili and English for those who don't know how to speak it. And then on the other hand, we have the government saying the CBA that doctors are asking for was implemented before the coming of devolution, and so doctors need to go back to the negotiating table. And then on the other hand, we have doctors saying we're standing strong, we're accepting nothing else other than that CBA. So everything seems to be in a deadlock. What is next for the doctors?
Okay. From the doctor side, the CBA was signed in June of 2013. That was after devolution.
Right.
I think where the government has been having issues is with who signed the CBA. And then secondly, at that time devolution had happened. There's no mention of the 47 county governments. So I think that's where the government is saying, no, health is a shared function, it's a devolved function.
Right.
We should sit on the table and renegotiate. But what the advice that the government should seek, and the doctors, is like, okay, fine, we have the CBA saying this, the government has their own reservation, the doctors have their own reservation, but we have a strike. What
And
is
we have people dying.
Yes, what is the immediate thing to solve? Solve the strike. The CBA, whether it was signed by the wrong party or not, has points that if listened to, if talked about or if discussed, then we'll solve the health problem
in the country.
In the country for a considerable period of time. Then the government and the doctors can still go back to the table and redo another CBA and now incorporate all stakeholders.
Right.
But right now, what should be of critical concern is to have the doctors go back to work. And what would it take it to go back to work? Drafting an implementation matrix.
That's all the doctors need.
That's all the doctors want.
All right, many thanks. That is our Dr. Mercy Korir there on the situation with the doctors' strike. Remember, doctors did reject that deal by President Uhuru Kenyatta, who offered them a 40% pay increment. We'll be keeping tabs on this story, of course, as we bring you updates on the state of healthcare in the country. And that brings us to a close here on a KTN News Center. My name is Michelle Ngele. Do catch me at the top of the hour for more.